Healthcare and senior care is fraught with problems and challenges, but we're also seeing some amazing new clinical treatments and resources. This show will help illuminate and uncover the good, bad, the ugly in order to equip patients, families, and other healthcare providers. Welcome to Senior Care Confidential.
Good afternoon, Brian.
Hey, Joe.
How are you doing today?
Fantastic.
We have an awesome guest, a rock star guest, Priscilla Romans today, and we are talking about COVID. So we know at Senior Care Confidential, we talk about the good, bad, and the ugly. This is a controversial topic talking about the new COVID variant. Should we be wearing masks? Should we be boosted? And we have a special guest, Priscilla, who has been written up in the Epic Times and really knows her stuff on COVID, just the different side of things you may not see in the regular newspaper. And so I love your information, Priscilla, and let's just get started. I do want to say you are a care advocate, a nurse advocate. You're a registered nurse, myself too. And you are really kind of the one that got me started working as a care manager. So I thank you for that.
Oh, nice.
I do a little different variety than you do. There's so many things that nurses can do now. And, but I love your confidence and I love the fact that you just say it like it is. And so let's talk about, tell me what you think about this new variant and should we worry?
Well, if we're going to be real honest today.
We're going to be honest today.
We're going to be real honest, okay?
We're going to be real honest.
COVID is such a difficult topic for people to talk about just because of what happened in 2020. It kind of brings back that PTSD, nightmares. Everybody goes to thinking about all the mask wearing, the lockdowns, the businesses that got affected. It really was difficult during that time. So now with all the headlines coming out, I see COVID again, and people are talking about a new variant. And let's just put it this way. It's the BS variant. There's going to always be variants with things, right? This is viral. Viruses change over time. That's why everybody past years would say there's a new flu. There's a new flu. Okay, well.
So it's no different than the flu.
Well, remember, we go back to what people are experiencing, signs and symptoms, right? I don't diagnose. I'm not a doctor. But what I can say is the BS variant that's out right now, people need to really start thinking about their immune system. Go back to what's the root cause. So people go, I don't think I ever got over COVID. Some people are experiencing what's called long COVID. Well, they haven't gotten better because their immune system isn't where it should be. So we don't want to ignore the current signs and symptoms and just think it's like the cute new BS variant. You're going to miss things. And that's what happens in patient care is the gaps happen, right? We don't think about maybe there's a root cause that we really need to be thinking about and has nothing to do with COVID. We don't want to get distracted with diagnoses. We want to understand what's the root cause. So us as patient advocates, we have to really think outside the box and not to get distracted because that's what happened in 2020. That's why there were so many deaths. That's why the protocols didn't work because it wasn't the patient protocol. It was the big healthcare protocol that was used in the hospitals. It wasn't appropriate for everybody. It wasn't. We helped many people struggle in the hospital, communicate with their doctor saying, I don't want that protocol, but they didn't even know what they did want. So it's very important as patient advocates for us to educate to say what is really going on. If you are feeling sick, absolutely we've got to do something about it. If it is COVID, great, let's actually do something about it. Now we get to those other topics you talked about. Do we go get another booster, right? Do I keep swabbing myself with these tests that maybe are giving a false positive?
Well, and I went to the fabric store on the way here, and one of the women that was cutting the fabric had on an N95 today. And so, obviously she is terrified.
Right.
So I know Dr. Biden has COVID right now.
Yeah.
We've heard about it on the news, and she has been vaccinated. She's been boosted the max number of times.
Yep.
she's had COVID and now she's got it again. So what would you say about that?
Yeah, I have a lot to say about that actually, because we have to ask the question, why is she getting sick? If she got double vaccinated, if that's what she got, or just the J&J and now has gotten multiple boosters, what has that done for her? And now she's sick again? I mean, I don't know. She might not want to come out of her house for several reasons, maybe because her son's misbehaving, if we really want to be honest. But I mean, that's just the truth, my opinion. But she's sick for a reason. And she put, in my opinion, foreign ingredients in her body, unless she got the memo, because I know a lot of people who went and got the COVID vaccination, they're still wondering what they put in their body. Mm-hmm. And now they are sick. They've gotten COVID multiple times. People call us all the time. I'm sick again. I'm sick again. I got COVID again. Now I have cancer. We're seeing people that have never, ever been so sick except for after their vaccination. So I would just have people think, did they start getting worse after they got the vaccination? And then we have to ask ourselves the question, are you vaccine injured? Because injuries do happen. Just like a medication, there are adverse reactions with medications, pills we put in our body, right? So why wouldn't people get sick after a vaccination that we know? I don't have the memo of all the ingredients. Do you? I'm wondering, where's the memo? I would love to know what are all the ingredients, because some people are very, very sick. We've got a lot of great doctors and people out there talking about what is going on with the spike glycoproteins in the body that's replicating even on autopsy after people have died. And they're going, well, what do we do? Is this related to the vaccination or not? The relationship cause, is that a factor? I've got questions. I need more answers. But as a patient advocate, I'm going to continue to ask these questions because that's why people come to me.
And just a question too, Brian. I'm sorry. I'm just so fascinated.
Sorry.
So, okay, I had the J&J. And 2 days after I had the J&J, my daughter lived in Manhattan and I wanted to be able to visit and take her to restaurants. And so I had the vaccine. 2 days later, it was taken off the market. And yes, I was a little nervous about it. I did have a really bad reaction. I reported to the VAERS, the VAERS.
Good job doing that.
Center.
Good job doing that.
I've not yet to receive any kind of a thank you. How are you feeling? How are you doing? Tell me about those symptoms. So tell me, what is the purpose of the VAERS? If people say they decide they do, or they are nervous about this new strain and they want to get a booster, say they do have a complication, what do they do?
Well, first of all, good job reporting it, because we have to also think about how many people have not reported their injuries to the VAERS, right? Nobody's really monitoring it. They have very little staff that are monitoring and getting back. That's why you're not hearing anything. And honestly, let's just be really perfectly clear about this. Why would they really want to dig through that information? It's a reporting system. They can say, yep, we have somewhere people can go.
I mean, I wonder if if it's public knowledge, that we could see how many people have actually.
Well, you can actually go and find per lot type. There is a place where you can actually, our advocates do screenings where we can look up the lot and you can actually see what are the risk and mortality with that type of lot that's given. Remember the vial, every vial, they have a lot number that goes with it. And that's how they do the tracking. Well, if people do report, right, they have to also report what lot they got. So there is a mechanism where you can go find that information. However, there's not a lot of great reports, because when you went and did the VAERS, was it easy to do? No, that's exactly the point. They don't want to make it easy. I question that. Why are we making it so complicated with a new COVID vaccination? We should be able to place that information in very quickly. You think about the doctors and the nurses in the hospitals. They don't have time to do that. They don't. I used to work at the bedside. They had no time to sit there and go, let me go put in a VAERS note right now. It's not happening. So I hesitate to go, all the information is in there. It's not. We're missing a lot of data points, and that's really critical to understanding then how do people make an informed decision about going to get another vaccination or another booster or even their flu or pneumonia, right? I question everything. And I think people should, because they are changing things in the vaccination pharmaceutical companies alone, right?
Well, after my just reaction to the COVID vaccine, I'm nervous about shingles. I'm over 50. I suppose should be getting the pneumonia, flu, and shingles vaccine, and I'm not getting any of them.
Yeah.
I'm not comfortable.
Yeah, and that's your right? You get that opportunity to say no. That's what a lot of people don't know what to do with. They don't even know they can say no to their doctor, because right now, today, this month, in September and October, we think about all the texts and emails that are going out from doctor's office going, remember, it's time for your next booster. Remember, it's flu and pneumonia season. Come on and get it. I would say, whoa. What exactly are you doing for your immune system? Because if you think a quick drive-through to go get a vaccination in your arm is the answer, I hesitate to really say that might not be the best answer for you. Maybe there's other solutions you should think about, such as your immune system, your God-given immune system. How do you really get that put together?
How do we fight infection?
How do we fight it? And we can. And you actually can through natural remedies. I know, it's crazy. You actually sometimes don't need a pharmaceutical. And we think it calls from moms going, the doctor gave my child another antibiotic, or gave my mom another antibiotic, and their gut is just ripped apart. Well, what's the antibiotic for? What's the adverse reactions of the antibiotic? Is the doctor just giving you a prescription just to appease you so you leave the office, right, and say he didn't do anything for me? But for viral things, antibiotics don't work. They don't. So we really need to start talking about those things. And I know a lot of doctors, because they're trying to keep their patient satisfaction scores up, they'll be like, yeah, I wrote an antibiotic so I could keep them quiet. I did something, but it wasn't the right thing. It wasn't. And that's what we should be doing as patient advocates, as my team advocates for people globally, not even here in the States. We help people globally find options that they deserve to know.
So I have a client right now. She's 75, has never had the vaccine, does not want the vaccine. So she asked me to ask you, what does she do if she gets COVID?
Well, first of all, I would tell her get a patient advocate, because
and she's got one,
right? So that's number one. So she can really ask those questions and make sure when she's going to see the doctor, they're getting the right labs done, right? Is there any diagnostics they need? I would review the medications. I would also review the supplements, right? Very basic things. What's the vitamin D level? A lot of people play in a vitamin D level that is in the normal ranges. A lot of people really should be at a higher vitamin D level. When you have a higher vitamin D level, you actually can ward off more advanced diseases than a low one in that, 30, 40 range. Some people, when they have advanced disease, they should really live at a higher vitamin D level. So a lot of great naturopathies and information out there that people can go look and say, what does having a higher vitamin D do? That's information they should go look, and they can get a blood test to say, where am I at? And they should be asking that, just like the typical lab test. People go get a CBC, a CMP. Well, what about the vitamin D? What about it? So very basic, very something that people can tangibly do, and then start asking questions. And then if they need to up it when they're sick, which they probably need to do, right? And they need to talk with their doctor about the supplements they're on. And if their doctor doesn't understand supplements, you need to get a new doctor, divorce them. They're not any good, okay? I mean, that's the reality. You should be able to talk to your doctor about anything. And you should be able to tell them about all the natural things that you're taking. It shouldn't just always be about pharmaceuticals and testing. What are you doing for your immune system? And if that doctor doesn't know and doesn't talk about nutrition, I don't think that's a great doctor. Or at least getting you in touch with somebody that does know how to do those things. It's very important.
Well, so a couple quick questions for you.
Okay.
On the vaccine injuries, because I know you filled out the VAERS. Is there a time period where it can be related to potentially the vaccine, or like once you get past a certain, I don't know, 6 months or a year or whatever, if disease processes crop up, then is it attributed still back to that, or what's kind of the general rule, so to speak, of that?
That's a really good question, because even when people come to us and they say, I think that the issues I'm having is related to the vaccine that I got.
Yeah.
I'm talking to my doctor about it, and my doctor doesn't want to talk about it being a vaccine injury because they don't want to write it down as a vaccine injury, because other things happen with that, too. And doctors
We've had many of those.
Right.
Yep.
And that shouldn't be. That they should, number one, they should be able to talk to their doctor about a vaccine injury that they think it is.
For the layman, why can't the doctor say it is vaccine related?
Well, I would even go a different step. I would ask your doctor, have they ever diagnosed anybody with a vaccine injury? And I'm going to almost tell you, they're going to say no, because they don't want to, because that is in conflict with the pharmaceutical industry, right? Does that make sense? I mean, it's that can be very, like, almost a conflict of interest. And that's scary for people, because they go, well, they don't even want to talk about it. And they might not have ever treated anybody with a vaccine injury or recognize their issues as a vaccine injury. So that's why you do have to have a doctor that's able to diagnose and help walk you through those things.
But there's a difference, though, in like what you experienced in your first 48 hours, and we know many people
and
who had
2 years
that.
Later.
Yes. So how are you figuring out what's true vaccine injury versus
a lot of
life?
It is subjective, right?
Yeah.
Because the doctors don't want to diagnose them. I can't diagnose them because I'm not a medical doctor. But we can also use something called common sense, right?
Yep.
And it's amazing. We can use common sense still. It's awesome. And there's not a drug for that. So it's just like tap into it and think, what changed after you went and got the vaccine? Did anything change? And then down the road, maybe we're out 2 years plus from when somebody originally got their original 2 vaccines. And people are coming to us going, well, we got this, and we've been experiencing these issues, heart issues, unexplained, new cancer diagnoses, and actually multiple new cancers at the same time. So usually a doctor will diagnose cancer as a primary cancer. We've had doctors say, there's multiple cancers. I don't even know which one's the primary, where it even started. And that's what we call turbo cancer. Okay. So we can't do the cause and relationship, but we can use our common sense saying something changed. There's something going on in the body that has caused something to go awry. Right? And so when they inject it, they said it didn't stay in the arm, right? The injection went throughout the body. Well, we don't know where exactly it's going to go in each person's body, male or female, different ages.
Yep.
So that's why it's very confusing to go, well, I think that vaccine, actually, my loved one had a brain bleed from it. We've had these calls. Said, we really think this is related. They've never had these issues.
I think it makes it harder when we're not able or willing, because it's such a hot button issue. You feel uncomfortable
either.
Correct. But the problem is if people aren't willing to have the discussion in the first place, then it makes it even worse, because now we can't actually lay our cards on the table and go, okay, these are the things that we're clearly seeing. Like, you can look at population studies, you can see rises in X, Y, or Z. I'm sure you guys have looked at those things. And so, when did those things start happening? There's timelines of that. And I think it would be wise for us to have the discussions, because there are going to be some of those. There's going to be cancers that are not attributed to the vaccine. There's going to be heart issues that are not attributed to the vaccine. But the fact that we can't even have the discussion makes it hard to figure out what's what. And
we need good doctors to have that discussion with, because then we can get the right lab work, the right diagnostics, maybe sending them to a right specialty. There are options out there. And that's what we really want to uncover here, because people were going to get the COVID-19 vaccines thinking they were doing the right thing. They had other comorbidities, other things that were going on health-wise. And so it can be hard to contribute. But the bottom line is we've got to go back to what's the root cause and digging at that, because if we don't address the root cause, all we're doing is putting Band-Aids on things.
Yep. And we get a lot of questions, we're healthcare providers in the home. So we get a lot of questions about things, hey, especially early on, not as much now, although we're starting to get the questions now on with the rising, as you call it, the BS variant. But with the with the new variant,
the election variant.
Right. So, but we do get questions about that now. Like, what are you guys preparing for? In fact, I got a call just yesterday about that, wanting to know, hey, what's our policy on this? What are you guys looking at with this? What do you think is going to happen? Blah, blah, blah. So the patients are asking anyway. And the fact that they're coming to us is probably because we have a relationship with them. We're seeing them in their own homes, but that conversation isn't happening someplace else. And so that's why I'm glad to have you here, because at least it gives them some resource to reach out to. If these things are starting to happen, here's who you can contact to ask those questions to.
Mm-hmm.
Yeah.
And I know we're going fast. We've got very little time left. And the mask, I know there were 78 studies done that the masks do not protect you from COVID. So what are your thoughts on people wearing masks? I said,
take off the mask. Just take off the mask. We don't need the mask. You need your immune system to be built up. And there were studies. The Cochrane study is a good one. There's a lot of other studies people can go research. It didn't do anything. And I think it actually caused more harm than anything, because our society needs to see each other smiling and laughing. Mm-hmm. The babies need to be seeing our nonverbal skills. So take off the mask. Build your immune system, get a patient advocate. There are things that you can do to be awesome in life.
And what I love, I reach out to Priscilla if I have questions. I want the best for my clients, and I don't have all the answers. Priscilla has all the answers on this really
I don't have all the answers.
Stuff. You have a lot of answers, and you've got a lot of contacts.
She's been a great resource.
You've been an
sure.
awesome resource, and just appreciate so much. So if somebody wants to get in touch with you, how can they reach you?
Yeah, super simple. Just go to Graith Care, GRAITH Care, CARE.com. And you can go to the website and just click Get an Advocate. And we do a match processing with you in terms of what are your needs. We want to match you with the right fit advocate. And we're just really excited about helping connect those dots for you. So that way you are not fearful of the BS variant. And I know, doesn't it sound good to say that?
It
is. It's crazy. The healthcare system really does suck.
After being told to shut up for so long, it's going to.
Right. So take off the mask and be free. Medical freedom.
And ask questions.
Ask any question.
I know. Ask the doctor.
Yeah.
Ask the doctor.
All right. So we're going to move on that subject just for a second. So I know, because I want to give credit to you too, that I know outside of helping people navigate post-COVID, post-shot, all that kind of stuff, you do a lot of other things helping people navigate the mess of the healthcare system that we're dealing with. And so I know even in the hospital system, we were just talking before the show about some patients that I have currently that were frustrated with what's been happening in the hospital system. They're being left in bed for 24 hours a day, and then they wonder why they come home and they're, they're set back 3 weeks because now they can't get up and move around as easily. So you also help with those kind of things too. And you're you're not bedside because you do a lot of these things remotely, but you and your team are also there advocating for someone essentially at bedside or via the phone to say, hey, these are questions that you should be asking. Can you expound on that a little bit? Yeah.
Yeah, absolutely. So just take off the COVID stuff off the plate.
Yeah.
Any type of healthcare question that people have, whether in the hospital or at home or in Australia, we've done it. We've helped people in all 50 states, over 10 different countries right now. I think I lost track. We might be up to, I don't know, we've got quite a few more that have come in. And what's exciting about this is whatever the need is, we can fill that. Because our team, we have over 20 advocates. They all have different backgrounds, ICU backgrounds, pediatric, NICU, insurance advocate for those questions, PTOT. And those are, they can talk to and say, hey, I've got a loved one in Manhattan and I need to find a good home health. Now, Brian, we need your home health in some of these other places.
Absolutely.
I'm serious because there are some horrible situations out there where they're like, we haven't seen the home health. Yes, we are going to find a better option for you.
So I think a lot of people think that maybe the primary care doctor's job has been that, but that's not really what's been happening. So is that why they're reaching out to you? Because they're realizing that I'm not getting the answers or the pieces aren't fitting together or I have other questions and maybe the doctor doesn't have the time to spend
Yep.
to help these things. And like you said, you're also getting into, I know you're helping with the financial part of it too. Like somebody, just.
Yeah. I mean, they need it. So if a hospital isn't being clear in communicating with the patient, or let's say there's an insurance or a grievance. I mean, we even do case reviews. We've literally teed up the best cases to attorneys, so that way the attorney can go address the situation because there was negligence.
Yeah.
And that's very important. As patient advocates, we just go after, it doesn't matter what the situation is. We go figure it out and we go find the right people to make sure those things move forward for our people.
It's amazing.
It's amazing. Yeah. It's a lot of fun.
Yeah.
Mm-hmm. That's awesome.
Awesome.
I know. Thank you so much, Priscilla. You've been awesome.
Thank you.
We just love having you. And we want you to come back again for sure.
I won't talk about BS anymore.
It's okay. We thank you though.
Yeah.
And Nexus, Brian, how can we get in touch with you at Nexus if somebody needs some physical therapy?
Just email's fine. BRIAN Brian at nexushomehealthcare.com. I get emails and text messages all the time. So that's probably the best way to get in touch with me.
That's great.
Yeah. And how about you?
I am Joe Alt at joycaremanagement.com.
Great.
And we're all here if you need us.
Yeah.
And love our patients. So thank you so much. Y'all have a great week. And we will talk to everyone again soon.